As president, I'm also taking on the gigantic health insurance companies that have gotten rich on billions of dollars of government subsidies. And I want the money to go directly to the people. I want the money to be paid directly to the people so that they can buy their own health insurance, which will give far better benefits at much lower cost. By the way, what I told you about buying the drugs at this massive dollar discount, it's like from where it is, that's going to have a huge impact on the cost of health care.
That's President Trump in North Carolina on Friday, pledging better health benefits at lower cost. The president planning to meet with major insurance companies in a bid to lower prices further, saying that it could be another way to cut costs as millions of Americans face a potential increase in premiums in the new year. Congress, of course, adjourned last week, without extending the Affordable Care Act subsidies. They are set to expire next week. Joining me now is Maryland Congressman Andy Harris. He is the chairman of the House Freedom Caucus. Congressman, good to see you. Thank you so much for being here. So are you expecting blowback in the new year when you all come back January 5th by the Democrats who wanted those Obamacare subsidies extended to the extent that they might stage another government shutdown when funding runs out at the end of January?
Well, Maria, I think what this whole argument has shown is that Obamacare failed. It failed miserably. It was designed to fail. It was supposed to lower premiums. Premiums went up. The health insurance companies make tens of billions of dollars because they're actually incentivized to raise premiums and spend more money on Obamacare policies. The bottom line, it doesn't work. We need to provide relief to the 150 million Americans who are on ERISA-style plans, especially those with small employers. We need to make sure that they have a wide range of options at a lower cost. That's what we're going to concentrate on when we come back in January.
So what are you going to do? What's the plan?
Well, the thing is you have to increase options. So before we left, for instance, we expanded association health plans. It's an idea where you can pool risk in larger pools that may not be available to small employers and employees. We have to make sure that the employers can put money into what are called a choice account so that the average person, the average employee can go and choose their own plans from a wide variety of market-based options without extensive essential health benefits, which Obamacare has. It drives up the cost. There are many ways, market-driven ways, to reduce health care costs and health care insurance costs in the United States.
Yeah, and certainly the president's finding a lot of them in a short period of time. But I want to get your take on when you expect us to really feel the impact of the big, beautiful bill. I mean, President Trump has been promising bigger tax refunds for Americans due to the changes made in the bill. And I spoke with Treasury Secretary Scott Bessent on this program last week. He's expecting 3-4% growth in the first half of the year. He says we should expect substantial refunds in the first quarter. Watch this.
Let's go back. The one big beautiful bill was passed on July 4th, but for working Americans, it was retroactive to the beginning of the year. Most taxpayers did not change their withholding, so as a result, we're going to see very substantial 100 to 150 billion of refunds in the first quarter go directly to Americans' pockets. So the sooner they file, the sooner they'll get them. Our estimate is it could be 1,000, 2,000 per household, depending on the number of workers.
What about that, Congressman? What's most impactful from the big, beautiful bill, in your view, in terms of economic policy?
Well, certainly increasing the standard deduction increased the tax refunds that a large percent of families are going to get. Now, we have no tax on tips, which is great. Lowering the tax overtime certainly incentivizes economic activity, and that's important. To get this economy going again from the Biden years, we're going to have to incentivize economic activity, and that's exactly what the One Big Beautiful Bill did.
I'll tell you, it has some Wall Streeters expecting some serious growth in the GDP. I spoke with Louis Navellier last week on this program, who's been a growth investor, has been very successful for a lot of years. Listen to what he said. Here it is. What is your assessment of the macro story? How do you want to be invested in 2026, Louis?
We're going to hit 5% GDP growth. We're running 3.5 to 3.8 now, but they're going to be revising it up because the trade numbers, the trade deficit's the lowest in 5 years. The exports the second highest ever recorded with low oil prices. So that's going to big upward revisions. Obviously, a lot of the growth was onshoring, but even and the data centers. But if you look at the data centers, their order backlogs are up 20% quarter over quarter. So we're going to enter the new year with we're going to hit 5% GDP growth.
5% GDP. Do you buy that?
Well, that's pretty optimistic, but we don't need 5% GDP. If we have 4% GDP growth, we'll be doing fine. Again, we'll increase revenues, we'll decrease the deficit, and of course, get the economy going and get the economic sentiment going ahead of this year's elections. That's very important, and I think if we get economic growth, the Republicans will do just fine in November.
Yeah, I mean, you've got to believe if you're talking about 5% GDP growth, even if it's just for a time, for one quarter, that would be a very strong backdrop to buy stocks in the new year. And perhaps that's part of the optimism we're looking at with the big, beautiful bill's impact. The Department of Health and Human Services, meanwhile, announced a series of proposed regulatory actions carrying out the president's executive order, which bans what they refer to as sex-rejecting procedures on children. Gender reassignment surgeries, Congressman. You're a physician. You're a member of the GOP Doctors Caucus. What is your reaction to this?
Well, the GOP Doctors Caucus absolutely supports what the administration is doing. We think it's actually been ridiculous that we do gender-rejecting treatments on children, on minors. These are permanent. Some of them are very permanent. Obviously, surgery is. And to do that on a minor, we think is just wrong. So we support the Health and Human Services Secretary in this announcement.
Well, that is just extraordinary, that we are even discussing the idea that we would do gender reassignment on children, Congressman. How the heck did we get here?
I don't look. It's a woke environment in Washington. The Biden years were incredibly woke, and that accelerated under the Biden years. It's about time to tap the brakes on that, and that's exactly what the department did last week.
Congressman, it's good to see you. Thank you so much. Happy holidays to you, and we'll keep following your work, sir. Thank you. Andy Harris joining us this morning.